Hello and welcome to the MKM Healthcare e-learning influenza update session for 2015. This update is suitable for all immunisers involved with the flu immunisation programme, including healthcare assistants that have previously undertaken the foundation training. Please ensure that you listen and watch the presentation before you attempt to answer any of the questions. The aims of this session is to provide you accurate and up-to-date information on this year's winter flu programme in line with the recommendations from Public Health England and the Department of Health. These are the learning outcomes that will be covered throughout this presentation. Please take a few minutes to read these. Influenza is an acute viral infection of the respiratory tract. There are three types of influenza virus, A, B and C. Influenza strains A and B are responsible for most clinical illnesses. Influenza is highly infectious with a usual incubation period of between 1 to 3 days. Serological studies in healthcare professionals have shown that approximately 30 to 50% of flu infections can be asymptomatic, but the proportion of flu infections that are asymptomatic may vary depending upon the characteristics of the influenza strain, with common symptoms including sudden onset of fever, chills, headaches, muscle and joint pains and extreme fatigue, dry cough, sore throat and stuffy nose, and in young children, gastrointestinal symptoms such as vomiting and diarrhea may also be seen. In healthy individuals, flu is usually unpleasant but self-limiting, and recovery will normally take place within 5 to 7 days. The risk of serious illness from flu is higher among children under 6 months of age, older people, and those with underlying health conditions such as respiratory disease, cardiac disease or immunosuppression, as well as those ladies that are pregnant. The groups that are at greatest risk of complications from flu, such as bronchitis or pneumonia. The impact of flu on the population varies from year to year and is influenced by changes in the virus that in turn influence the proportion of the population that may be susceptible to infection and the severity of the illness. The graph shows that the rate of flu and flu-like illness episodes in England and Wales per 100,000 consultations in primary care from the period of 2008 to 2014-15 season. The data shows that the flu virus circulates each winter season, but the degree of activity varies substantially. Moderate levels of flu activity were seen in the community in the UK in the 2014-15 flu season, with influenza A strains H3N2, the predominant virus circulating for the majority of the season, with influenza B circulating towards the end of the season. The health impact was predominantly seen in the elderly, with numerous outbreaks in care homes and levels of excess mortality significantly higher than the last notable significant H3N2 season of 2008-2009. Admissions to hospital and intensive care were observed, with a peak in intensive care units and high dependency units numbers higher than seen in the previous few seasons, but lower than the recent notable season of 2010 to 11, which affected mainly younger adults.